This morning on BRN, new technology may help treat hearing loss more effectively. Joining me now to discuss this, Dr. Daniel Sun from the University of Cincinnati. Dr. Sun, so great to see you. Thanks for joining us this morning.
Thanks so much for having me.
Yeah, it's great to talk to you. And look, we have, as I was telling you in the green room, in the virtual green room, we've covered hearing loss from a couple different perspectives. We've talked about cochlear implants. We've talked about getting hearing testing. You're doing some very interesting research now about new technology and how that can aid and treat hearing loss. What are you working on?
We're mainly working on three different technologies that could be really interesting for people with hearing loss. The first one is that we're looking at some very different ways to program cochlear implants so that they may be able to deliver sound better, kind of like getting an update, for the cell phones that we have.
Yeah, yep.
The second one is that we're actually using some state-of-the-art imaging techniques to understand how our brains could change once someone has hearing loss. And we're hoping that that's going to allow us to better treat people with hearing loss in the future by understanding how our brains are actually changing. And the third technology we're working on are special delivery nanoparticles that could get medications into the inner ear better, where hearing loss is actually happening.
That's certainly amazing. I mean, it's obviously the benefit of living in the 21st century. Are there different kinds of hearing loss, doctor? You mentioned cochlear implants, you mentioned nanotechnology, but are there different types of hearing loss, and would these new techniques and tactics apply to all of them or just some of them?
Yeah, that's a really great question. So generally, we think of two main types of hearing loss. The first kind is the much more common kind where sound just has trouble getting into the ear. That's what's called conductive hearing loss. And that happens, when our kids have an ear infection and may need a tube to clear that fluid. The second big kind of hearing loss we think about are what happens as we get older. So as we get older, our hearing nerve just doesn't work as well as it used to be. And that's called a neural hearing loss. So the technologies I mentioned are all meant to deal with different forms of neural hearing loss.
Not to put you on the spot, but I know you're just starting the research. How long does it take, generally speaking? I'm not going to, again, not putting you on the spot. How long does it take to do the research and to have a practical application? I would imagine there's multiple steps. You've got to go through I assume the FDA or some other regulatory body and you have to go through clinical trials. But how long does it take from start to finish to get something out to the general public?
Yeah, it actually really depends on the type of research. So for instance, the cochlear implant programming and the imaging research I mentioned, they're actually in patients right now. We are actually studying that in real patients with hearing loss on a daily basis because that technology is already ready to be applied to humans. The nanoparticle research, that's what we refer to more as basic science research, meaning that, that's just the very start of the journey of something from a scientific lab all the way down to eventually when it can be in clinical trials.
Yeah, and hearing loss has so many different impacts, doctor, to people. I think about cognitive decline. If you can't hear, it's really hard to engage with people. There's a lot of social isolation that comes from it. This could be really revolutionary. So if you were talking about the hearing nerve or the nerves of the ear and the connectivity, forgive me, I'm a layperson, but if you could really, and your team solve this issue, you could help older people who suffering from isolation, they can't hear, cognitive decline.
Yeah, that's a really great point, Jeff. I think, one thing that our field and a lot of my, colleagues and friends have really found over the past decade is just how closely related hearing loss and cognition are. And and I think that's one thing that really inspired and motivated our work with imaging. We really want to understand, on an MRI scan, for instance, is the brain changing as we lose more hearing and as we spend more time without good hearing? And our hope is that that can actually translate to better and more personalized treatments for different patients. For instance, one challenge that a lot of clinicians face and patients is once someone has had hearing loss for a long time, how do we know what technology is going to work for them? We don't have a good idea, but if we know how their brain has changed, that may point us in the right direction.
Doctor, just to end our interview, is it still best practice for if you haven't had any hearing loss, or if you detect just a little bit of hearing loss, is it still best practice to see a clinician, to get a hearing test, to see what exactly is occurring?
Yeah, I think our hearing sometimes can be a hidden disability because we can lose a lot of hearing and adapt to it and feel like we're doing okay because it happens so gradually. And we're surprised once we get a hearing test and see how much hearing loss has actually happened. So, for sure, if, we feel like our hearing is changing, it's always a good idea to get a hearing test and make sure it's okay.
Yeah, and also probably best to turn down those AirPods that are in our ears and to stay away from large construction equipment. I'm thinking about jackhammers as well. Dr. Sun, we're going to have to leave it there. Thanks so much for joining us. Congratulations on the research, and we look forward to talking to you again very soon, sir.
Thanks so much for having me, Jeff. Glad to be here.
And don't forget to subscribe to our daily newsletter, The Morning Pulse. Details at our website. Until tomorrow, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.